Hi, I'm Dr. Leaky.
And I'm Dr. Kathleen O'Neill-Smith.
Welcome back to the FIRRIMup Doctors Good Medicine docu-series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Hello and welcome back once again. We're so happy you're joining us for week 16 of our COVID updates. Things are still going, but we're happy to have everyone that still joins us each week. We're very thankful and appreciative for all of you. And now I will let our FIRRIMup doctors come on, Dr. Anjali Mon-Akey and Dr. Kathleen O'Neill-Smith. And as always, if you need to reach us, you can chat us in the box on Zoom, or you can email us at either of the emails listed below.
Hi, everybody. It's so nice to see everybody coming back week after week, and we hope you invite your friends and family as well. And for those live streaming on Facebook, welcome. So yeah, we're 16. Oh, Liz says she can't hear anything. Hi, Dr. Kathleen from Boston. Can you hear?
I can hear great. Yeah.
Okay, so let's see. All right, so so it's week 16 on the FIRRIMup Doctors webinar. It's week 26 for the local crowd in Gainesville. So we're still in the middle of this pandemic and it hasn't gone away yet. But I did spend about an hour listening to the Senate hearings yesterday. And one of my doctor heroes, Dr. Francis Collins, who's the NIH director, he's MD, PhD. He was updating the Senate on the vaccine, where we are with the vaccines. And he went through the 6 biotech companies who are all racing with different mechanisms to come up with the vaccine. But the punchline is that he said he's cautiously optimistic that we'll have a vaccine by the end of the year or the beginning of next year. So I thought he's a reliable source. I'm happy about that. And he went through the 3 different mechanisms for those vaccines. But essentially the government's investing money, knowing that not all those vaccines will work, but they work in different ways. And so I was really happy about that.
Fantastic. That is awesome.
How's it going in Boston? We're still...
Ooh, Boston, we're upticking, and I'm sure it's going to continue after Labor Day, with even more schools coming back. And I think it's hard. People have been lax over the Labor Day weekend, and certainly in the Cape area, which is where a lot of people go on the weekend, there was 150 to 200% increase in
wow.
cases. Yeah, so big increase.
Yeah, so were they physically distanced?
I imagine more because we're pretty strict in Massachusetts than I've seen in other places. Mm-hmm. But, in California was 112, right, this weekend. So I think more, but it doesn't really matter because if you just have all those people in one space and backyard barbecues and things like that, it's tough.
Sure. Well, that's how it's been here in Gainesville with the students coming back. There have been these accidental exposures because in general, the younger population, young adults, they don't have as many symptoms, or then they come down with it later, and lo and behold, they'd exposed a lot of people. So that's kind of the local story. Next slide. So here are the updates from North Florida and Boston. So in the United States, 6.4 million confirmed, 191,000 deaths. 191,000 plus deaths. Many have recovered. My population and our population in North Central Florida, even those who have recovered, many don't feel normal. It's almost like mono, where they have this residual fatigue or muscle aches or brain fog.
It's a lot like mono. Yeah.
Yeah. So in Florida, 4.8 million tested, 12,319 have died. More than Boston by like 3,000 now. So we passed up, we passed up Massachusetts. In Alachua County, 5,800, almost 5,900 confirmed, 36 deaths. We've had over 30 COVID patients. And like I said, the residual is not wonderful. I mean, I think out of all the ones I've managed personally, only two are perfectly healthy like the way they were before.
Oh,
So,
really? I have a lot. I have a lot more. I have a lot
oh,
more
good.
come back. Maybe they can't smell as well. It's coming back, but you know, these are people from April, late March, April, and I have some people who are still sick, but the majority are better.
And the ones that are still sick, what are their symptoms?
Fatigue, brain fog, inability to concentrate, and it's really I mean, I have 3 people in 1 week that really had some tightness in their chest.
Yes, the respiratory residual.
I don't know if it's respiratory or if it's, I don't know. I think it might be myocardial as well. I don't think it's heart attack, but I think there's a tightness with flow. So yeah, I don't know.
I had this one. There's 2 that I'm investigating now from post-COVID. One has a new abnormal EKG since her COVID experience. And the younger one, the one that's actually patient 0, she actually has new mitral stenosis versus only a year ago. So really interesting. I'm trying to figure this out, and I'll keep you all posted.
All my patients have had the cardiac eval. They all look fine. So
Good.
my thought is that it's functional. That there's
Okay.
a neuroinflammation, neurogenic inflammation of some sort that's feeding to the heart and causing, they mostly also feel palpitations pretty regularly.
Oh, and that's going to feed right into our talk on vascular effects in just a minute.
Well,
perfect. So how are you doing in Massachusetts?
You know, we have the uptick. We have the uptick that I just talked about. I don't remember the numbers from last week in terms of confirmed cases, but definitely a lot more confirmed cases, more sick people, but still nothing like we had in the winter. The deaths are up a little bit, but they're going up slowly. And each county, like Suffolk County actually is the inner city of Boston, which remarkably compared to like Cape Cod, the vacation spots, is relatively down. Like I think their percent increase was less than 10% this past week, whereas the Cape was, 150% or more.
Wow.
Yeah.
Wow.
So we're really seeing it where people are gathering, but in those communities where they had higher rates previously, they're better. But it's just kind of one of those things. It's not going away right now.
No. Next slide. So in Alachua County, 29 hospitalizations. Again, the case fatality rate is relatively low, 5 out of 1,000. And this week we've been really good at our 6,000 person practice, only 2 or 3 with COVID, and they're recovering quite nicely. So it's been a good week in North Central Florida for us as a practice. So today's topic is, how does COVID-19 infection affect the blood vessels? And next slide. So before we go into this, I thought it might be wise to review the anatomy of a blood vessel. So basically on your right, you have a relaxed blood vessel, and the interior part, the light pink string of pearls, is the endothelium of the blood vessel. And then you have the muscles and the other layers. So the bottom line is that when you get COVID-19, it causes a lot of inflammation. And with the inflammation comes increased clotting. And so the next several set of slides actually go through some of the studies, but I don't want you guys to get lost in the words. And so that's why we need to stop and really look at this vessel and realize that there are big vessels like the heart arteries, and there's tiny little arterioles or tiny little vessels that feed every tissue in your body, even in the fascia. Do you have any comments on that, Dr. Vanilson?
Sure. I mean, I would say that an accepted theory of COVID is that it's an endothelial disease. And the endothelial, as Dr. Akey said, is that inner string of pearls. It's the innermost layer of the blood vessel. And the blood is to flow through here and to deliver nutrients, take away toxins or breakdown products, metabolic breakdown products. And so we really want this blood vessel to be very, very healthy. When the blood vessel sees infections or when the innermost, the endothelium, is experiencing this overwhelming infection, there are multiple different chemicals, including the nitric oxide that you see there, we've talked about previously, that get released. So lots of chemicals get released, and we'll show you some of this in the next slides, but it's really important that as these vessels become inflamed, what you realize is that the vessel becomes smaller. It becomes more constricted. And there's nothing good about constriction. The only good thing about constriction is if you don't have blood flow somewhere and you constrict to send it there, that could be good, but it's only good temporarily. So the goal is for the blood vessel to be pliable, to be able to open and dilate, particularly if there's inflammation that's trying to close it and constrict it, but it can also be pliable and constrict if we need to get blood flow somewhere. With COVID, we ideally would like to have more dilatation, more dilation of the blood vessels so we can deliver healthy oxygen, healthy nutrients, remove metabolic byproducts that are harmful, and that's really important. And we'll look at a lot of the chemicals that are involved in that.
So yes, great explanation, Dr. Kathleen. So we don't get lost in the language. I just want to point out a couple of things more before we move on into a couple of studies. So remember from Dr. Nathan Bryan's talk on July 10th with us, the importance of the gas called nitric oxide, which actually dilates. And so it's like a river that, you know, you want more blood flow to tissue because you will deliver more nutrients and oxygen, right? So that makes sense. So nitric oxide actually dilates that, so it grows. It has more capacity. And so it's also anti-inflammatory. It inhibits the clumping of platelets, and platelets are like the glue within our bloodstream. And we found that with COVID-19, you get clumping and clotting, and you don't want that. It also inhibits the sticking of white blood cells to the inner layer of that pink string of pearls, the endothelium. Nitric oxide inhibits the rusting of lousy LDL cholesterol, and it allows a smooth muscle to proliferate. So in terms of healthy vessels, nitric oxide, as we hopefully have told you, and you remember from July 10th, is critically important.
And the platelet activation, I mean, all of those things happen because these chemicals get released. And one way you can think about this, you may or may not know, but if you have high blood pressure, oftentimes doctors, not me, but doctors, other doctors, will typically need to use 3 different kinds of hypertensive drugs, medications that reduce your blood pressure. And so that speaks to the different kinds of chemicals that will be released in this environment when there's inflammation or when there's a microbe like a COVID-19 that's present or anything like that. And it's another reason why steroids do help with COVID-19, because they'll reduce that inflammation and reduce some of the activation through some of the chemicals, not all of them. That's why we need multiple drugs and what we call a cocktail of medications in order to treat some of these diseases like COVID-19 that constrict or close the blood vessel.
Great point. So one other term before we move on so we don't get lost in all the words. There is a peptide of 9 amino acids called bradykinin, which actually causes this vessel to leak. And you can get leaky vessels and leaky brain. So imagine that in your mind's eye. Keep that picture of the relaxed vessel in your brain as we go through these next set of slides, because there's a lot of words.
Right, and look at those little pearls and where those pearls connect. And right through those little pearls, you'll be able to, that's where the leakiness begins, and then it goes out into spaces the blood doesn't belong.
Yeah, like in our Kick COVID-19 to the Curb book, we talked about barriers. Think of that as a barrier disruption. It's another barrier disruption. When
Absolutely.
the pearls are no longer airtight, they start leaking. And we'll discuss the importance of bradykinin and causing it to leak and what complications you have there in just a moment. Next slide. Okay, so with that background, 2 things to remember about the COVID-19 infection is that it's now thought that it's a problem of that inner lining, the endothelium. So fancy word, endotheliopathy. So it causes the inner lining, that light pink string of pearls, to be messed up. And the platelets, which are the glue that stops clotting, they get a little overactivated. And that's why we actually see evidence of increased clotting in the lung, clotting in the brain, or stroke, which we talked about, I think, just a week or two ago, and increased heart attack. Remember when we talked about the complications of COVID-19 in the brain? The youngest in that China study, out of over 200 people, there were 5 that had strokes, and the youngest one was only 27 years old. And that's because of the platelet activation. Okay, next slide. So if you get admitted to the hospital, actually, because you've moved into phase 3, remember there's 4 phases to COVID-19 infection, and we're monitoring you every day, and we're concerned your lungs are getting involved, you know, your oxygen's down to 93% or lower, we put you in the hospital, you will get blood thinners because we're that concerned about this coagulopathy, fancy term for saying increased clotting. Okay, so that's what it's saying, is that this COVID-19 associated coagulopathy is an endotheliopathy that's increased by certain factors that we see in the blood work. And that's why you can have clots in the veins, in the arteries, and in the smallest vessels. And we think this is actually, we're not totally sure, this is from Lancet only a month ago, but we think it's because of the direct viral infection of those cells. Remember, there's ACE2 receptors in the vasculature. So the virus can infect the cells. The SARS-CoV-2 virus infects the cells and has collateral damage by the massive inflammation.
So the silver lining to, you know, some functional medicine, the way that functional medicine is practiced, is that when you realize the silver lining to COVID-19, I think, is that now people, because they see in real time all of the different systems that can be involved when you get infected with COVID-19, and then also how we need a cocktail of medications to help treat it, and then how things can continue to be not working well, systems can continue to not working well over time, as we talked about earlier. So this direct viral infection, a direct toxic insult, not from the virus, but just generally speaking, any other virus, any other bacteria, any other toxic insult can damage cells, can damage the layer of the cell, like the endothelial cell, and allow for leakiness. And whenever there's leakiness, there's collateral damage. Whenever there's leakiness, other systems will be involved. So that's the interrelatedness of all of our systems within our body, and all of the way that the systems function, dependent on each other, and interdependent on each other. So I use that. I mean, luckily now people can really understand how protecting one organ protects another organ.
Yeah, I really think that this whole pandemic has brought that whole field of functional integrative medicine forefront, because that's what we have to prevent in the first place. But the science is also supporting it.
Yeah, and what we'll talk about in the future when we're going to talk a little bit more about health is, you know, this immune system, the immune infiltration, the inflammatory system, and then also this rusting system that Dr. Akey talks about, of oxidative stress or free radicals. So we'll educate you a little bit more on that, and give you some easy words to understand that as well going forward.
Yeah, but the most important thing is you get the big kind of 60,000 foot view and the big concepts. So yes, next slide. So basically the part 2 to this FAQ is, there's this paper that got published only 7 days ago, that thinking that in addition to cytokine storm, which we have talked about ad nauseum to you all, there's this bradykinin hypothesis. And again, bradykinin causes leaky vessels. And it's 9 amino acid peptide that it gets stirred up with inflammation. But for years, we've been talking about leaky gut, leaky brain. Well, this actually in a supercomputer said, yeah, bradykinin's probably involved with this leakage. And the fancy term is increased vascular permeability. And that alongside the respiratory disease with COVID-19, you get the vascular disease. And I really think this is why ours that actually have individual symptoms actually have had leaky brain, leaky brain. An MRI study in France revealed that many COVID patients had leaky blood vessels in their brain. And so as Dr. Kathleen was talking about, whenever you have leakage, you'll have collateral damage. I think when that happens in the brain, that's when you have that brain fog and residual COVID brain.
Or leaky blood vessels anywhere, leaky cells, because that's what will give you the muscle pain, and that will give you a lot of other things. And bradykinin is intricately related to the cytokine storm. And then also we know that bradykinin regulates blood pressure through its work in the kidney, through its work in the blood vessels, through its work near the heart. Bradykinin, it's one of those things in medicine that nobody really likes to talk about a lot because it's all these intricate pathways. But when I read this analysis, I was like, wow, aha, absolutely, positively. This is the explanation for multi-system disease. And even when you think of the multi-system disease that happens, multi-inflammatory system disease that happens in kids, there's got to be something related to this bradykinin. There's absolutely. And probably genomically that they're predisposed to this bradykinin problem.
Yes, and it's even this paper that was again published just last week. Bradykinin hypotheses developed to explain the many aspects of COVID-19 virus, including all the bizarre symptoms that have occurred. So once you can see how it's working at multiple levels, bradykinin surely is involved with this.
For sure, no doubt.
Third point for today. This is just a reiteration. We've taught you with Dr. Brian all about nitric oxide. I mentioned it on our first slide. This is just to remind you to eat your beets and green leafy vegetables. Next slide. And to exercise, do not use mouthwash. Antiseptic mouthwash decreases the healthy bacteria that help make the nitric oxide, and moderate physical exercise. So those were the 3 FAQ points for today, was to help you to understand that it is a coagulopathy and an endotheliopathy, that bradykinin is intimately involved with leaky vessels, leaky brain, multi-system disease. And please don't forget Neo40 and eating your green leafy vegetables and beets and not using antiseptic mouthwash. Next slide. So the only question I see today in the chat is about, should I go to the gym? Should our patients go to the gym, Dr. Kathleen?
I do not think that you should go to a gym where there's a lot of people. For sure. I don't think that you should do group classes unless they're outside and
or on Zoom.
Or on Zoom, but also if they're outside and physically distanced. If you go to a gym where you can see somebody privately and there are very few people there, like I know trainers who have 1 or 2 people at a time. Those 2 people generally are in their same bubble. They go to gyms. I think that's fine. But ideally, why not work out outside now that it's only 90 degrees in Florida and 60 degrees in Boston? So it's not 110 where you are anymore.
Yeah, and also for our patients in North Central Florida, I hired a personal trainer who'll go to your house and set you up a high intensity interval circuit in your house. You could do it yourself 3 times a week or work out outside and walk. So I'm not going to the gym yet. If you work outside, wear a mask, not if you're by yourself. When I work out by myself outside, I don't wear a mask. And when I walk, I keep a mask in my fanny pack in case I run into people. Otherwise, I don't use a mask outside.
It's pretty unrealistic that if you're just walking, you're walking, somebody else is walking and you continue to pass. It's pretty unrealistic that you'll catch COVID like that, but it's just polite. I mean, I think you can or cannot, but some people get really kind of upset here, I know in Boston. So just out of courteous nature, I try to put a mask on if I pass them, or I go far enough away that there's just no way, I'm 10 feet away.
Yes. So great. Thank you. That's all of the questions. So listen, this crowd has been with us for like 26 weeks. Some of you for the past 16 weeks with the FIRRIMup doctors. And Dr. Kathleen and I have the same vision of functional, integrative, regenerative, restorative internal medicine. That's our background. That's what we want to share. We want to pivot to more of the wellness parts of our specialty. So what we're going to do is we're going to pivot next week when we talk about physical activity, and we promise to keep you updated with COVID. Certainly if there's a vaccine or something that we really think we're going to, that's really reasonable, we'll interrupt our schedule, but our new schedule will be still Thursdays 3 to 3:30, but the themes will be more on wellness and how to fortify yourself, because that's what we are passionate about, actually. And then the second Thursday of every month will be the COVID update, more like in this format. So if you have interests that you want us to address, be it chronic pain, I know that we're into fascia as well, since we just wrote that hormone chapter in fascia in the fascia textbook that just got released. There's a lot of things, but we're going to meet and try to come up with a curriculum and post it ahead of time so that you know what topics we're going to talk about at least a week or two ahead. So come next week, we're going to talk about the importance of physical activity and wellness with a little bit of a COVID tilt, but that's our plan, and we hope you guys like it. And thank you so much for coming week after week. And please share the link with your friends and family, where this is on Facebook Live. We upload it to our website on YouTube like the same day. So if something's really interesting or inspiring to you, please share it with your friends and family. And we really appreciate you all coming week after week after week.
Yeah, and we're still happy to answer your COVID questions. That's not going to be an issue. But as we go through the, the health and wellness revolution that I think no doubt we have to do now, right? I mean, we have to do that because we have to continue to get through this pandemic and anything else that follows, and also any of the, we call them sequelae, but the consequences of this pandemic for people, whether it's, with brain pain, gut, any leakiness that we experience. But we definitely want to just shift a little bit and not make it, so, I don't know. I mean, not be so focused on COVID. We want to make it now more general so that we help you understand more about overall health. So we're looking forward to that. I'm really looking forward to that. And I thank you all for being here throughout this whole thing.
Yes, thank you so much. So thank you, Dr. Kathleen, for coming in from Boston. And for you all, be safe, be well, and God bless you all. And thank you, Emily, for facilitating.
Oh, Emily, thank you so much. Thank all of you. Have a beautiful day.
Bye for now.
Bye.
As we say bye to our wonderful doctors, I will continue on with some of the supplements we have. For those of you that were on when Dr. Nathan Bryan came on and talked about nitric oxide, we still have these same supplements, the NO indicator strips, and then both the tablets and the dissolving lozenges for nitric oxide available on our Get Healthy website. You can either go to the link firrimup.gethealthy.store/ or you can find it on our FIRRIMup Doctors website. It'll be under the shop tab, and then you'll see the Get Healthy store. And then, as usual, our Fascia book is still available on FIRRIMupDoctors.com. It is also available on Amazon, but on Amazon, you cannot get the 20% discount. So if you are looking for that discount, you will have to buy it through our website. And again, the 20% discount is good for both the hardback and the ebook. One of those is out of stock right now, but if you go ahead and order it, I'm sure it will come back in stock, or it'll show you the one that is in stock. But again, you can go ahead and take 20% off, and it will bring it down to $43 for your paperback. And last but not least, as always, our September special. If you purchase our guidebook, Kick COVID-19 to the Curb, either ebook or paperback, you can get 20% off of the supplements, vitamin C and zinc AG. Again, our ebook is available on Amazon Kindle, Google Play, and Barnes & Noble for $9.99, or available in a paperback version for $29.99, which you can find either on our website or by calling or emailing us. Just make sure you have proof of your receipt that you purchased this either through us or through Amazon, Google Play, or Barnes & Noble, and we will make sure to honor that for you. So that is it for today. We will see you all next week and talk about physical activity. And I hope everyone has a wonderful weekend.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM Doctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.